Have you ever gotten a phone call from your doctor's office asking you to come back and repeat your blood work? Or maybe you've wondered why your healthy results one month look completely different the next. I'm going to let you in on something that might surprise you. Most people sabotage their own lab results without even knowing it. After years of reviewing thousands of blood tests, I've noticed patterns, simple things people do that turn accurate results into medical mysteries. Today, I'm sharing the insider knowledge that most healthcare providers assume you already know. But honestly, why would you? These aren't obvious mistakes, and some of them might actually shock you. By the end of this video, you'll know exactly how to get the most reliable results from your lab work every single time. 1. The hidden saboteurs in your medicine cabinet. Let's start with something that trips up even the most health-conscious people: your daily supplements and vitamins. You might think, they're natural. They can't possibly interfere with medical tests. Wrong. Here's a story that perfectly illustrates this. A woman came to me convinced she was developing thyroid problems. Her TSH levels kept coming back abnormally low, suggesting an overactive thyroid. She was experiencing anxiety, trouble sleeping, feeling jittery, all classic symptoms. We were about to start her on thyroid-blocking medication when I decided to dig deeper into her supplement routine. Turns out, she'd recently started a popular Beauty from Within supplement for her hair and nails. The culprit? A massive dose of biotin. This vitamin literally hijacks the laboratory equipment used to measure thyroid hormones, creating fake low readings. But biotin isn't the only troublemaker. High-dose vitamin C can make your blood sugar appear lower than it is. Iron supplements can skew multiple liver function tests. Even those trendy collagen powders can temporarily affect kidney function markers if you're taking large amounts. The solution isn't to stop taking beneficial supplements. It's to be strategic. Stop biotin-containing products 72 hours before testing. For other supplements, create a complete list and review it with your healthcare provider. Some need to be paused, others don't. But hiding what you take guarantees confusion later. 2. The dehydration trap that fools everyone. Here's something that sounds backwards but is absolutely true. Many people who think they're preparing for blood work actually make their results less accurate by changing their normal routine too dramatically. I see this constantly with hydration. People either panic and avoid all fluids because they heard fasting, or they chug enormous amounts of water thinking it will clean out their system before the test. Both approaches backfire. Dehydration concentrates everything in your blood. Your kidney function markers spike, electrolytes get thrown off, and the phlebotomist struggles to find your veins. I've seen creatinine levels that suggested kidney disease in perfectly healthy people who simply didn't drink enough water the day before their test. On the flip side, water loading, drinking way more than usual, dilutes your blood and can mask real problems. Your sodium might appear dangerously low when it's actually normal. The secret? Maintain your usual hydration habits in the days leading up to your test. If you normally drink 8 glasses of water daily, keep doing that. The morning of your test, have 1 or 2 glasses of plain water, even if you're fasting. Your veins will thank you, and your results will be accurate. 3. The timing mistakes that create medical emergencies. This one could literally save your life, so pay close attention. Some people get so focused on following the rules for blood work that they make dangerous decisions about their regular medications. I had a patient who stopped taking his blood pressure medication for 3 days before his annual physical, thinking he needed to be clean for accurate results. He ended up in the emergency room with dangerously high blood pressure the night before his appointment. Here's what you need to understand. Most chronic disease medications should be continued exactly as prescribed. Your blood pressure pills, heart medications, seizure medications, these are keeping you safe every single day. Stopping them for a blood test is like removing your seatbelt because you're going to check your car's safety features. The confusion comes from diabetes medications, which sometimes do need timing adjustments. But here's the key. Never make these decisions alone. Some diabetes drugs can cause dangerous low blood sugar during fasting, while others are perfectly safe to continue. The smart approach? When your doctor orders blood work, specifically ask about each medication you take. Get clear instructions written down. Your prescription bottles should keep working for you right up until you sit in that lab chair. 4. The exercise myth that mimics disease. Exercise is medicine, right? So surely working out before your health checkup shows how committed you are to wellness. Actually, this innocent mistake can make you look like you're having a heart attack or kidney failure. Here's what happens inside your body during intense exercise. Your muscles break down microscopic amounts of tissue. This is normal in how they get stronger. But when they rebuild, they release specific enzymes into your bloodstream. The enzyme creatine kinase can shoot up to levels we typically see in heart attack patients. Your lactate dehydrogenase might suggest liver damage. Even your creatinine can rise, making your kidneys appear to be failing. I remember a marathon runner who came in for routine work after a particularly grueling training run. His enzyme levels were so elevated that the lab called me worried he was having a cardiac event. We nearly sent him to the emergency room before we figured out the real culprit. The irony: this person was in phenomenal health, but his dedication to fitness almost triggered unnecessary medical interventions. Time your workouts strategically. Light walking or gentle stretching is fine, but save the intense training sessions for after your blood draw. Your dedication to health shouldn't accidentally suggest you're unhealthy. 5. The social calendar sabotage. Let's talk about something nobody wants to admit affects their health. Alcohol consumption. Not the daily glass of wine, but those occasional social events where you might indulge more than usual. Picture this scenario. You've got blood work scheduled Monday morning. Over the weekend, you attend a wedding, go to a retirement party, or take that wine country trip you've been planning. You're not a heavy drinker, but you definitely enjoyed yourself more than usual. Monday's blood work shows elevated liver enzymes, high triglycerides, and concerning glucose levels. Your doctor starts talking about liver problems and diabetes risk. You're panicked, scheduling specialist appointments and researching serious conditions online. Here's the reality. Alcohol temporarily disrupts multiple metabolic processes. Even moderate amounts can elevate liver enzymes for days afterward. Your triglycerides can double or triple. Your blood sugar regulation gets thrown off. This doesn't mean you're developing liver disease or diabetes. It means your body was processing an unusual load when you got tested. The solution isn't to become a teetotaler. It's to be strategic about timing. If you know you have blood work coming up, either schedule it before your social events or wait a few days afterward for your body to return to baseline. Your results should reflect your typical health status, not your weekend celebration. 6. The stress connection. Nobody talks about stress doesn't just affect how you feel. It literally changes your blood chemistry in measurable ways. Yet most people don't consider their emotional state when preparing for medical tests. Chronic stress elevates cortisol, which can raise blood sugar levels even in non-diabetics. It affects your immune system markers, can alter cholesterol readings, and even impacts how your thyroid functions. But here's what's really interesting. Even acute stress from the medical appointment itself can skew results. I've seen patients whose high blood pressure readings were simply white coat syndrome, but whose blood chemistry also reflected that stress response. Their glucose was elevated, their inflammatory markers were up, and their hormone levels were all over the place. The morning of your blood work matters too. If you're rushing, running late, or anxious about the procedure, your body responds as if you're in danger. Your stress hormones spike, your blood sugar rises, and your results reflect crisis mode rather than your normal state. Plan for calm. Schedule your appointment at a time when you won't feel rushed. Practice some deep breathing in the waiting room. If you're dealing with major life stress, illness in the family, job changes, relationship issues, mention this context to your healthcare provider. It helps us interpret your results more accurately. 7. The food timing confusion. Everyone knows about fasting for blood work, but there's a lot more nuance to the food and timing relationship than most people realize. The standard advice is nothing but water for 8 to 12 hours. But what you eat in the days leading up to your fast can be just as important. If you've been following an extremely low-carb diet and then get glucose testing, your results might suggest insulin resistance when you're actually perfectly healthy. Your body adapts to using fat for fuel, and when challenged with a glucose test, it responds differently than expected. Conversely, if you've been eating more refined carbs than usual, maybe you've been stress eating, traveling, or celebrating holidays, your baseline glucose and insulin levels might be temporarily elevated even after a proper fast. The same principle applies to fats and cholesterol testing. If you've been eating significantly more or less fat than usual, your lipid panel might not represent your typical levels. For the most accurate results, try to eat normally in the week leading up to your test. Don't start a new diet right before blood work, and don't dramatically change your eating patterns thinking it will improve your results. We want to see how your body handles your regular lifestyle, not how it responds to sudden changes. 8. The sleep secret that changes everything. Your sleep patterns affect your blood chemistry more dramatically than most people realize, especially as we get older. Hormones like growth hormone, cortisol, and melatonin all follow precise daily rhythms that can be disrupted by poor sleep. But here's what's particularly relevant for blood testing. Many hormone levels need to be measured at specific times to be meaningful. Cortisol should be highest in the morning and lowest at night. Testosterone peaks in early morning hours. If your sleep schedule is disrupted, these natural rhythms get confused. I had a patient whose morning cortisol was surprisingly low, suggesting possible adrenal insufficiency, a serious condition. Before ordering extensive testing, I asked about his sleep. He'd been up most of the night before the test, dealing with a family emergency. When we retested after he'd had several nights of normal sleep, his cortisol levels were perfectly normal. The week before your blood work, prioritize good sleep hygiene. Try to maintain consistent bedtimes and wake times. If you're someone who works shifts or has irregular sleep patterns, let your healthcare provider know. They might need to interpret certain results differently or schedule tests at different times. 9. The temperature and season surprise. Here's something that might surprise you. The weather and season can actually affect certain blood test results. This becomes more relevant as we age and our bodies become more sensitive to environmental changes. Cold weather can temporarily affect circulation, making it harder to draw blood and potentially affecting certain measurements. Some people's cholesterol levels vary seasonally. They might be higher in winter months when activity levels decrease and comfort food consumption increases. Vitamin D levels naturally fluctuate with sun exposure, so testing in late winter might show deficiency that resolves naturally by summer. Thyroid function can be subtly affected by temperature extremes as your body works to maintain its core temperature. If you're getting blood work during unusual weather, extreme heat waves, cold snaps, or if you've recently traveled between very different climates, mention this to your healthcare provider. It's probably not significant, but it provides helpful context for interpretation. The key is understanding that your body is constantly adapting to environmental conditions, and sometimes these adaptations show up in blood tests in ways that might seem concerning, but are actually normal responses. 10. The follow-up failure that wastes everything. Here's the mistake that undoes all your careful preparation: not following through with result reviews and follow-up care. You did everything right: proper fasting, good timing, honest communication, and then you ignore the results or delay addressing concerning findings. I see this pattern repeatedly. People get their blood work done as part of routine care, but then life gets busy. They assume no news is good news, or they see results online that look mostly normal and figure everything's fine. But blood tests are just data points. They're most valuable when they're interpreted by someone who understands your complete health picture and can spot trends over time. A result that looks normal in isolation might be concerning when compared to your previous tests or vice versa. Even more importantly, some abnormal results need prompt attention. Waiting weeks or months to address significantly low vitamin levels, kidney function changes, or blood sugar elevations can allow problems to progress unnecessarily. The solution is simple but crucial. Schedule your follow-up appointment when you schedule your blood work. Don't wait for someone to call you. Take ownership of understanding your results and what they mean for your health going forward. Your blood tests are one of the most powerful tools we have for understanding and protecting your health, but only if they accurately reflect your body's true state. These 10 insights can help ensure that every test you take provides reliable, actionable information, rather than confusing false alarms or missed opportunities. Remember, you're the expert on your own body and lifestyle. The more accurately you can communicate with your healthcare team and prepare for testing, the better care you'll receive. Your health is worth getting it right.